Newsfirst Newsline with Faraz Shauketaly.
And a very good morning to you. This is Newsline, live from the Newsfirst studios in Dawson Street in Colombo and broadcasting on TV1. And joining me on the set this morning is Dr. Dhanapala Rodrigo. Sorry, did a quote there. Dr. Dhanapala Rodrigo, a retired anesthesiologist who's made his home in the United States, but returns to Sri Lanka to pursue almost a passion to reform healthcare. Very good morning to you, Dr. Rodrigo.
Good morning.
And thank you very much for being on the program.
It's a pleasure.
Doctor, your book, An Unfinished Journey, I love the introduction. Every doctor has a story to tell. We see the tears, we see the smiles. Medicine is a blend of art and science. In our youth, we learn the science of medicine. As we get older, we learn the art of practicing medicine. And how fares our medical service in this country?
I would say it's good, but it could be improved.
It could be better.
Oh yes, in any country it could be better.
Okay. So, when you did your preliminary, you passed out here and then you worked your
73, yeah.
slot here.
Yeah.
And then you went to see the world.
Yes.
As young people tend to do.
Yeah.
But you saw the world.
I saw.
And
I
having
did.
seen the world, and then when you looked in on your land of your birth, what did you see?
What do I see? Well, we have a different culture.
Yeah.
Okay. In Sri Lanka, there are certain things really excellent.
Yeah.
But in certain areas, I think we have to improve, and we have to move with the rest of the world. That's what I feel, especially in my field.
Dr. Rodrigo, do we have the money in Sri Lanka to improve the healthcare?
Yes,
We do.
we do indeed.
Right. I'm then drawn to this comment in a letter that you wrote to the Secretary of the Prime Minister at the time. And it's part of that letter is, if I may say, we have the resources. What we lack is the vision. To reach where we want to be in 25 years from now, we have to make radical changes today. To make these changes, we will go through some turbulence and chaos. There is no alternative. These are very powerful words, but they were written in 2002. Do you see a big change since then?
Yes,
It's
of course.
13 years now,
Yes.
14 years on.
Absolutely.
Do you see a change?
Yes.
And like what?
Like when I started, we didn't have the specialty of emergency medicine. Okay.
Right.
In England, they call it A&E, accident and emergency.
Emergency.
In America, they call it emergency room. When
Right.
they started in a room, that was
That's
the
how it
reason.
was,
Okay.
yeah.
But now we need a bigger unit. But now see.
So this is what you call, in 1995, you set this up, and you called it, you renamed it actually.
I had to.
You had to rename it from emergency room or emergency care to preliminary care unit.
Yes.
So these, what made you want to change the name?
Yeah, because no one listened to me when I said emergency care.
Okay.
They said, "Oh, we have that."
Right.
Okay. So then one of my friends advised me, change that name. Don't use that.
Your friend was absolutely marvelous. He must have been in the PR business. In public relations. What was
no,
he?
he was my batchmate, Dr. Ganesha Ratnam, a
Okay.
surgeon at that time in National Hospital.
He must be, his real calling must have been that of a PR man.
Yeah.
But yes, so it's wonderful. So you got people to listen to you once you
yes.
changed the name.
After changing the name, yes.
So rebrand, you went for rebranding in a way.
Yes.
Okay. So, and that was 1995, and that was
Yes.
in Kegol, in the State Hospital in Kegol.
Yes.
And You've done how many of these preliminary?
I did about 12.
Right.
But they are also doing now, for example, Karapitiya.
Yeah.
Yes, and they are in the process of doing it. Actually, it's a national policy now. Now, to answer your first question,
Yeah.
see now within these, I would say 10 years, we have a specialty now. The first set of graduates, first batch of graduates, they graduated, I think about 2 months ago.
Yeah.
And they are called senior registrars now.
Yeah.
And they will go abroad next year and come back
Yeah.
and take over and start these units.
I see. And how many beds or how many special beds? Because they're not rooms, are they? They're these special beds that can be wheeled in and wheeled out.
Yes, you're absolutely right. We don't have them here yet.
Right.
Trolleys.
Right, trolleys.
Yeah.
But I must tell you, Dr. Rodrigo, that maybe these are also part of your initiative, the preliminary care unit. In 2013, after I was shot, I was treated at Kalubowile initially and then transferred to the Colombo General Hospital. And I must say that the level of care, I was in the ICU for about 4 or 5 days. Anyway, I must tell you that the care was absolutely first class.
I'm very happy to hear that.
I had nothing but ongoing admiration for that team. They're brilliant. It was first class. It was clean. It was professional. It was brilliant. And each trolley bed had its own team, and doctor, and so on and so forth. And it was absolutely brilliant. There was a young boy who was in the bed next to me, and he'd been knocked down by a train, and he was, all the time I was there, he was there. And when I left, he was still there. And I often wondered what happened to him. But the team there, they used to come and talk to him the whole day. I mean, as you know, people are not allowed to come into the ICU. They let his mum come in for a bit in the morning and a bit in the evening. But during the intervening periods, nurses would come and sit with him and hold his hand and talk to him. But the boy was unconscious. And, they just spoke to him as though, he was listening. And perhaps he could listen. But it was very touching and very warm, the level of care. So I want to say that I'm a big fan.
Isn't that what we need in healthcare?
That's what we need.
The care you received, the warmth, the kindness.
Yeah. Because all the medicines must be the same.
Yeah.
It's that extra bits that make it.
Yes, absolutely.
So, do you think that we have a... Why is it that when we go to these hospitals outside of Colombo and so on, it appears that there is an ambience of chaos, maybe organized chaos, but that's the feeling one gets. It's busy. It seems to be overcrowded. Is it? What can they do to get rid of that?
It's a big question you are asking me. Everything has to change. We must develop what is called family medicine or not primary care.
Right.
Like in England, GP practice.
Yeah.
In America, they call it family medicine.
Yeah.
I think in Cuba, they call it community or something like that.
Right.
Patients, not only the public should be assigned to doctors in their area, in the government service.
Right.
Okay. And so they cannot go to some other place. If they want to go to some other place, then we change the doctor. Like, I will give you 2 examples, like Mattakuliya and Maligavatta.
Yeah.
If the patient is not happy at Maligavatta, then they can, okay, you select any other doctor, but then we are going to refer everything to the other place, so you cannot come back again.
Yes,
and they can't go from doctor to doctor.
Which is need to have that.
And those doctors are also well trained. It's called family medicine.
Right.
Yeah.
Will any of these problems be helped if we change the Minister of Health?
I cannot answer that question.
You think you'll have to change all the ministers each time they become ministers of health?
You are asking me a difficult question. I'm not a politician.
No, that's right, that's right. No, I thought I'll ask you. Because usually people say, oh, change the minister then. Well, you know, we can change the minister, but what's the point? You get another minister. So therefore, my question to you is it a systemic change that we are after?
Yes. Let me answer it in two ways. One thing is the leader must have the vision and should be able to inspire and motivate the people who work for him. Mm-hmm. Yes, the other thing is, yes, it's a change of a system. We have to introduce that family medicine and get rid of what we call these OPDs. Mm-hmm. Because the OPD is there in that place with that doctor. And on the other side, we should have this preliminary care units or emergency units. Mm-hmm. So for the episodic illnesses, moderate and major, they go to the preliminary care unit.
Right.
Okay. For minor things like the cough and cold, they go to their own doctor. Yes. So then there won't be any overcrowding. Right. And the nurses or the staff, they will have some peace of mind.
So it's a better structuring of the system.
Yes, complete overhauling, restructuring, yes.
And are you involved in any such thing here?
Yes and no.
Okay.
Yes and no.
Yes,
I work with
as a...
Yeah. Now, like ideally, we should have a committee, right, including everyone, including the patient, all the stakeholders. Right now, we don't include the patient. When I say patient, not really the patient, the public.
Yeah.
So I am really asking for that committee, the minister, the relevant minister.
Really one national committee?
Yes, national. I call it the national forum.
Yeah.
And the patient is also represented, all inclusive, all the basic colleges, like Sri Lanka Medical Association, Government Medical Officers Association, all the basic colleges, and then we discuss those things. Then we must have a steering committee for the new projects. And this is very, very important. You can't send a circular and expect an end state administrator to implement it. He cannot do that, and we shouldn't even ask that. We must send a task force. So I was my only task force. I used to go and give the appointments to doctors, to the patients.
Right.
I used to sit with the nurse or the minor employee, and I showed them how to give. I got the patients and gave them the appointment.
Right.
I wonder if you understood why
I did. I did. Yes. So but how? I mean, you need a lot more human capital to do all this.
No, absolutely not.
Okay. So they can do it with the available.
Absolutely.
Really?
Yes.
And isn't this wonderful? Because now that we know, almost always, you propose anything, and the stock answer will be, we have no money.
We don't have the resources,
yeah,
right?
So now you're saying we have the resources, what we lack is the vision. Do you think we lack the commitment?
I cannot answer that question. Yes, in a way, but we can develop that. We can get the people to commit. I know that through my personal experience.
Doctor, it's like this. Routinely. You know, we have people talking about, when I say people, I'm talking about our legislators, politicians in our world. They talk about doing this and doing that, all supposedly for the betterment of the people, of the delivery level, the service delivery to the public. Very nice, very noble. And then you see this little thing in the paper on the corner somewhere. The minister, so-and-so, XYZ, has gone to Singapore for medical treatment. We had a case where at the time the Minister of Health also went to Singapore for medical treatment. It was very upsetting.
Yes.
I'm not talking of whether the minister is exercising his right to go because he's got, he's financially able or whatever. I'm not looking at it from that angle. What I am looking at it is on a PR side, here you have the Minister of Health who's saying, look, we're doing this, we're doing that, to up the level of service delivery to the patients. But then you swan off to Singapore at several times the cost, clearly. Perhaps paid by some fund, I don't know. Or the minister's own fund, or the minister's supporters. We don't really care about all that, but you know, what's the message it sends to the people?
A friend of mine, I would not mention the name, I can even mention the name because he publicized, okay? A professor of surgery.
Yeah.
He had a very difficult condition, a clot in the brain,
Okay.
in a certain artery called basilar artery.
Right.
And it was removed here in this country.
Right.
And I thought it was not possible.
Right.
And now he is going to give a talk, I think, I understand, next month.
Right.
Many of my colleagues, they had their surgeries and everything done. We are not behind. We are not even behind in many countries, but we need a little fine-tuning.
A bit of tweaking here.
Yeah.
In there.
I'll give you one example.
Yeah.
Like in a toilet, when you go to the toilet,
Yeah.
these are the basic things. There should be a hook inside the door.
Yeah.
For them to hang the IV bag, you know, the saline
Right.
bag, you
Yeah.
know.
Okay.
These are the little things we have to correct,
Right.
not big thing.
Yeah.
We have all the resources.
We have.
Of course.
It's just fine-tuning.
Yes.
Is it a constant battle to finish this journey? This journey of...
Actually, my part is over now. If I'm right, that again I will say finished journey. See, now these consultants are coming out.
Right.
So in 2 years' time they will take over. But then where are they going to practice? Kandy, there's no good unit yet. So we have to plan. I'm not blaming anyone, but we have to plan. How many beds do they need? Things like that. But
How much are one of these trolleys, these fully fitted trolleys? What sort of money are we talking about?
I don't know, maybe 30,000 rupees.
Really?
Yes.
That's it?
That what?
Is that it? Just 30,000?
That's what I was told, roughly. Oh, we can turn them out here in this country.
I see.
Yeah. It doesn't have to be that fancy as in America. It doesn't have something that works.
You can get an awful lot of money for billions of for 5.2 billion rupees. You can get a lot of beds then.
Yeah. But first we have to have the structure, basic structure.
Yeah.
And we should have a blueprint, like what the components should be, like the lobby and the toilet for the lobby.
So what are you doing? Have you knocked on people's doors and said, "Oh, listen to me, I'm retired. I've got time." Have you written more letters like you wrote to Mr.
I wrote to everyone.
in 2002?
Sometimes I don't get mostly I don't get any responses.
You didn't even get a response?
When my daughter was 10 years old, her cousin, some young fellow, did not get the visa to come to America.
Right.
She wrote a letter to the congressman.
Right.
Congressman called these guys and got letters from them why that little boy was not given the visa, and responded to my daughter. If I write a letter to the White House, I get some kind of a response.
Yeah.
Here you write to anyone, you won't get any response.
This is an appalling lack of manners.
It is.
Let everything else. It's an appalling lack of manners.
Yeah, and the battle cries, you studied here with the public funds and you go abroad, now expatriates must come and help.
Yeah.
Where should they write to? Nothing.
Right.
There are so many people who would love to come and help.
But are you finding, so obviously you're finding that nobody's listening to you? Or if they are, their level of disinterest is amazing.
The patients are very much interested in my project.
Right.
Patients.
Your project being this, the preliminary care units.
And the family medicine.
And the family medicine.
medicine.
And so do we have a network of doctors already with their surgeries and so on? Or do we have this network of, where would they go for family care? Would they go to the hospital again?
Right now they go to OPDs.
Ah, okay. Right.
So what I said was, there should be a doctor now. Let us say Mattakuli or someplace like that, okay? All the patients are assigned to the doctor there. Not one doctor, there may be two, there may be three.
Yeah.
And they run all the clinics, antenatal and this non-communicable one. So the patients, they are belong to that doctor.
Right.
The doctor should know.
And they're taken out of this emergency room business.
No, emergency, it has to be there.
Yeah, the emergency is there, but it's only for emergencies.
Only
it's not
for the
common
moderate
cold.
and like the patient has a fever for the last 2-3 days, not eaten or drunk, anything, something like that.
Yeah.
That patient should go to that emergency unit.
Right.
They sort it out, basically.
They sort it out.
But then we have to develop that family medicine.
And how is that going? Do you find that it's slowly started?
No, it is not starting.
Oh, it's not even started?
No.
Oh, God.
See, there are family medicine. In fact, I spoke to the professor here at the Colombo University.
Yeah.
Very difficult to get it started. We don't have that connection. We have a total disconnect between the authorities, the government and the ministry and the periphery, including the doctors. So that's why I say that we need that committee, forum, national forum.
And have you tried to speak to the minister in charge of the subject of medicine?
Can he? I did not, but I wrote him a letter. The usual thing happened, but he cannot do that alone. There has to be a committee.
He can make a start.
Huh?
He can make a start.
Yes.
He can make a committee.
Yeah, that committee.
And he can start listening.
Yes.
So that will be a start.
Yes, you're right.
Have you got
But
his phone number?
No, I don't have.
Shall I give it to you?
Why don't you talk to him and say?
We'll send him a recording of this program. But it's very frustrating.
Yes, not about emergency care.
No, no, I don't mean
yeah, family medicine.
medicine.
The whole
so
thing.
You must be your perseverance levels must be very high.
Yes, I
you
think
keep
so.
knocking on the door and then nobody's answering. And
Yeah, then you go to the next door.
So you go to the next door.
And to the next.
And that's you putting something back into the land of your birth.
Of course. And that's the right thing to do. And I'm very, in fact, even when I went to that conference, the fellows told me, you're a very optimistic person. The foreigners.
Yeah.
Yeah.
Well, what do you feel, coming as you do from where you've made your home in the United States, how do you view free healthcare here in this country?
Far better than America. Hey, there the healthcare delivery system is horrible. I think 39th in the world.
Right.
Yeah, but it's getting better slowly.
So what's all this business about Obamacare?
You know,
What is Obamacare?
I don't. Well, everyone must have access to healthcare.
Right.
All this time they didn't have.
Right.
Okay.
In a developed country.
Yeah,
like that.
that's what we always say, the richest country, and people go to sleep without having health care. And year 1900, President Theodore Roosevelt tried to change it, and the doctors objected. And many people had some visions, like President Reagan, everyone. But they tried to follow the European model or the Canadian model.
So
but
what happens when somebody doesn't have insurance in the United States?
now, of course, yeah, that is a problem. For the family medicine, primary care,
Yeah.
no, then he cannot have it. For emergencies, they can go.
Irrespective
Without
of
money,
whether you have insurance.
For emergencies, yes.
Or after they care for you, do they detain you and say,
No, then that is a problem. After that, who is your doctor? They will ask.
Right.
I don't have a doctor. So they have to suffer. But it is slowly changing. As in Sri Lanka, nothing can be done overnight.
So it's the same even in the United States?
Of course. Here, look, anyone has the access to health care. You don't let them die on the street. You can go to a doctor. You can even go to that OPD and enter the system.
Yeah.
But they cannot enter the system easily. No way.
So what prevents them from entering the system? Is it the lack of having insurance or the lack of money?
No, again, it is the system. It's difficult to change systems. People are used to that, and some are comfortable in it and benefit from that system.
So basically, in the United States, what prevents people from joining the system is You must have some insurance.
Yes, and that's very expensive.
And it's very expensive. So therefore, to have insurance, you need money.
Yes.
And to get money, you need a job. Which is a vicious circle.
Yes, you're right. Yeah. The job is not a major problem, but not all the companies provide insurance.
You spent a long time in the US.
Yes.
Why can't they have the equivalent of what we in England have, the National Health Service?
How can I answer that question? So many people tried. There's something called...
What's the problem?
There's something called the Congress there.
Yeah.
That blocks everything. And the favorability rate is less than 10%.
So there's some form of corruption there too?
Of course.
There you go, folks. You heard it on this program. Corruption is not only the sole preserver of politicians and Sri Lankans. It's out there. It's happening out in the United States too. And perhaps Donald Trump, the president-elect, will...
He will correct it.
Perhaps he will. He's been out of the box so far.
Yeah.
How did you vote? Did you vote for Trump? You don't want to tell me?
No.
All right. Wonderful. Dr. Dhanapala Rodrigo, I wish you every success in your endeavors to help reform and help change the way medicine is dispensed and the level of care in this country. And, thank you very much for taking the time out to come on to Newsline. And as you may not know, or you may know, you can follow this program and all our programs through something called the internet and www.tv1.lk. And you can watch it live as it happens. So thank you again, Dr. Rodrigo.
Yeah, thank you for having me.
Oh, thank you for doing what you're doing for the people of our country. Thank you very much.
Yeah.
On that note, that's it from Newsline. Take care, and we'll see you same time, same place, tomorrow morning. God bless.
Newsfirst, Newsline with Faraz Shauketaly.